Okay, so I'm outside the room, I'm verifying my orders, and it looks like we're doing an NG tube insertion. So I have gathered my supplies, and I've checked the intactness of the packaging. They look good, and I've checked the expiration dates, and nothing is expired. So I'm ready to get into the room. Hi, my name is Annalise, and I'm going to be your nurse today. Can I go ahead and put these on your bedside really quick?
Yes, you can.
Thank you. All right, so can you verify your name and date of birth for me?
It's Ivy Armstrong and 3664.
Perfect. And do you have any allergies, Miss Ivy?
No, I don't.
Okay, great. I'm going to go ahead and pull those clothes for a little bit of privacy, okay?
Okay.
And let me just wash my hands really quick. All right, Ivy, do you mind if I ask you a few questions before I explain what I'm doing?
Go ahead.
So, put some gloves on a little bit. Do you know where you're at?
Yes, at the hospital.
Okay, great. And do you know why you're at the hospital?
Because I have some toxins in my stomach.
Okay, and one last question. You've done great so far. Do you know what year it is?
2021.
Thank you for answering those. So, like you said, you have ingested some toxins. And because of that, the doctor has ordered that we do an NG tube insertion. So what that means is that you've got toxins in your stomach, right? And they need to come out. So what I'm going to do is put a little tube through your nose, down the back of your throat, and into your stomach, okay?
Okay.
And this will help remove those toxins later when we attach it to some suction. So you might feel a little bit of discomfort during this procedure. You might have some tingling as it goes in your nose, a little bit of discomfort at the back of your throat. In general, people don't normally feel pain during the procedure. However, I can't tell you that it's not going to be a little painful for you, okay?
Okay.
Do you have any questions?
I don't think so.
Okay, I'm going to go ahead and get some things set up, okay?
Okay.
So I moved your trash can over, and your lighting looks good. All the lights are on. Your bed is locked. I'm going to go ahead and raise it up a little bit, okay?
Okay.
Okay. So I'm going to get you all set up. So for this procedure, I'm putting you in this position that's called high fowlers. It means you're sitting almost all the way straight up. And this just helps the tube go down your throat easier, okay?
Okay.
Doing great. Let me just adjust this pillow. That's good. I'm going to raise it a little bit more. Great. Okay, I'm going to go ahead and clean off your bedside table, okay?
Okay.
Let me check your bed again. Yeah, still nice and locked. Okay, so I'm going to get all my supplies set up, and then I'm going to assess you before we get this inserted, okay?
Okay.
So I've gathered all my supplies here.
Okay. Move this over to my bedside. And I'm going to lower this rail, okay?
Okay.
Just need you to stay nice and still while I get these all set up.
I didn't my video for this.
Okay, so, like I said, for this procedure, the tube is going to go in your nose, down your throat, and into your stomach. So I need to assess 3 areas. I'm going to start with your nose, take a look at that, and then I'm going to take a look in your mouth, and finally I'm going to look at your abdomen, okay?
Okay.
Okay, so let's start with your nose. So first, before we get started, I'm going to have you blow your nose, okay?
Okay.
Go ahead and blow for me. Great. And now I'm going to take a look inside. I'm looking for any bleeding, okay? It looks good. I have a few questions about your history. Do you have a history of nosebleeds?
Nope.
Okay. What about a history of any facial trauma or any facial surgery?
Nope.
Okay. And then lastly, has anyone ever told you you have a deviated septum?
No.
Okay, great. That sounds good. So now I'm going to test to figure out which nostril we're going to put the tube in, okay?
Okay.
So what I'm going to do is I'm going to press against your right nostril and I want you to blow out of your left nostril, okay?
Okay.
Okay, go ahead and blow. Great. And now we're going to do the same thing. I'm going to press against your left and you go ahead and blow with your right. Perfect. Okay. So I'm feeling more air coming out of your right nostril. So I would like to place the tube in there because it's more open. Is that okay with you?
Yep.
Okay, great. So now I'm going to move on to looking at your mouth. So I'm going to shine this in the back of your throat. I'm taking a look for any swelling or any lesions. And I don't see any in your mouth, okay? So that's good. So this part of the testing is a little unpleasant, okay? Might bother you a little bit. I'm going to put this towel on top of you, okay?
Okay.
So what we're going to do is we need to test your gag reflex because it's really important that you have a gag reflex in order for us to perform this procedure, okay?
Okay.
Is it all right if I put this basin on top of you?
Yes.
Perfect, okay. So how we're going to do this is I am going to take this little tongue depressor and press it to the back of your throat, okay? It's normal for you to gag. If you feel like you need to vomit, this bucket is right here, okay?
Okay.
All right, I'm gonna go in. Perfect, and I felt that. There was the gag. How are you feeling? Are you okay?
Yes.
Okay, great. You did a great job. I'm gonna move this over here for now. So your gag reflex looks good, so we're good to go there. And now I need to assess your abdomen, okay?
Okay.
Is it okay if I pull your gown up a little bit to listen to you?
Yes.
Okay. So I'm gonna listen to 4 different areas to assess for your bowel movement sounds, okay?
Okay.
Okay. Let me go ahead and pull your gown down for you, okay? So that sounds great. You do have a pretty active bowel right now, but that's expected with the toxins that are in your system, okay?
Okay.
So now we are ready to go ahead and get everything set up. We've assessed all of our areas. So I am just going to get some things set up, okay?
Okay.
I'm filling up this water cup. Put some water in the straw. I'm going to put these tissues right here in case we need them. I'm going to put this basin back on top of you in case you're feeling bad. Is that okay?
Yes.
Okay. Just going to leave it right there. Here's our water.
So I wash my hands, and I put on fresh gloves before I touch them.
Oh, you know what? I need to change my gloves first before I get all that tape on.
The next one I'll do is remove this from the packaging. Usually would have the blue stuff, but we're kind of
Okay, Ivy, thanks for being so patient while I get everything set up.
No problem.
Okay, now we can cruise. Okay. All right, so before we get started, I need you to review a signal with me in case you need to stop. So like I said, it's normal to feel some discomfort during this procedure. However, if you need to stop, if you feel like you're gagging or you're really uncomfortable and you just can't handle it or you just want to stop, we're gonna go at your pace, okay? So if you need to stop, I want you to raise your hand in the air, okay? And that'll be our signal to stop.
Okay.
All right? And then especially if you're feeling nauseous, like you need to vomit, please raise your hand and let me know. And
Okay.
then we'll stop immediately. Does
good.
that sound good?
Yep.
Okay. So now I'm going to measure the tube, okay? I'm gonna measure from your nostril to your earlobe, down to the xiphoid process of your sternum. So we're right about 50. Just mark that with a piece of tape. Okay. So, one more time before we get started, please tell me what is the signal if you need to stop?
Raise my hand.
Okay, that sounds great. Okay. I'm gonna put some lubricant on this. Are you ready to go? Yes?
Yes.
Okay, so what I want you to do is tilt your head back a little bit, okay?
Mm-hmm.
I'm gonna help you a little. So tilt your head back. I'm gonna insert this through your nostril and I'm just gonna be checking on it with the pen light, okay?
Okay.
So keep your head tilted back.
No, not yet.
Okay, so I see it right there. So that's great. What I'm gonna have you do now is tilt your head forward and I'm gonna have you take some sips of water. So every time you take a sip of water, tilt your head forward, there we go. Every time you take a sip of water and swallow, I'm gonna advance this down your throat 1 to 2 more inches, okay?
Okay.
All right. Go ahead and swallow. Good, you're doing great.
I have videos on my dog.
Keep swallowing.
I think I can figure out. I just thought of it.
Okay, you can go ahead and take your water away. So we have made it all the way to the 50. How are you feeling?
Good.
You're feeling good? Okay, that's great. So you can talk normally. That's a great sign. That's what we like to see. I'm going to tape this to your cheek for just a second, okay? Just to keep it in place.
Okay.
And then I'm going to go ahead and I'm going to pull this towel away, okay?
Okay.
Use this bucket and put this in the dirty linens. Are you having any pain?
Nope.
Does your stomach feel okay? You're feeling irritated?
Nope. Feels fine.
It's fine, great. Sorry, this tape is not the stickiest. I'm going to go ahead and tape this to your gown, okay?
Okay.
There we go. Okay, I just want to tape this to your gown to make sure it's extra secure.
Okay.
Let's tape this to your gown. Okay. So now I need to ask for you to check the pH level of fluid. So let me get this air out first. I'm going to pull back 5 cc's. Okay. So we're going to do this pH test, and it's going to tell us if we think the placement is in your stomach like it should be, okay?
Okay.
So I'm just going to put this on the strip. Get these away. Okay. So the color is orange, which indicates a pH of 2, and that is normal for the stomach. The stomach content should be a pH of 0 to 4. So that indicates that the placement is probably in your stomach, okay? So I'm going to go ahead and tape this to your nose, all right? So it's nice and secure. So we're going to go under. There we go. Okay. So, let me change my gloves really quick, and then I'm going to help you get comfortable. Okay. So like I said, the pH test showed that it's probably in your stomach, right? Because we got a normal pH level for the stomach. But just to confirm that, we have an order to send you to radiology to get an x-ray, and that will confirm the placement. Of the tube for sure. It's in your stomach, okay? Okay. So let me help you get comfortable. I'm going to lower your bed down. I am going to keep you seated in this high position just until I can be sure that the tube is in the right place, okay?
Okay.
So let's lower you down, and then while you're gone, I will get everything cleaned up and have everything nice and clean for when you come back, okay?
Okay.
So let me just make sure your bed's locked. Okay, great. And then the radiology will come get you, okay?
Okay.
Okay, so now the patient is out of the room. I'm going to clean up. And then I'm going to wipe down the table. And perform hygiene. All right, Ivy, so you're back from x-ray. I took a look at your x-ray results, and it looks like the placement of the tube is good. It is in your stomach. So how are you feeling? Are you feeling okay?
Yeah, I feel good.
Okay. So what we're going to do now, let me raise your bed back up. Raise your bed back up this way. So the doctor has written an order for you to be attached to, your tube to be attached to low intermittent suction, and that's going to help pull all those toxins out of your stomach, okay?
Okay.
So I am actually going to lean you back just a little bit now that we know the placement's good. I can't let you go any lower than about 30 degrees just because otherwise we could risk pulling that tube out, okay?
Okay.
So this is good. And then I am going to go ahead and get you attached to this suction, okay?
Okay.
Let's go ahead and turn it on to intermittent. We want low. Let me check this. Perfect. All right, so how are you feeling with that suction on? You feeling okay?
Yeah, feel
Are you
good.
having any pain or nausea right now?
Nope.
Okay, so now that the suction is on and we've confirmed the tube placement, I do want to go ahead and listen to your bowel sounds again and then take a feel of your abdomen, okay?
Okay.
So is it okay if I pull your gown up a little bit?
Yep, that's fine.
Okay, so your bowel sounds sound good. They sound like they did before. I'm gonna go ahead and press down on your abdomen, okay?
Okay.
Let me know. Are you having any pain?
Nope.
Still no pain?
Nope, feels fine.
Are you feeling nauseous when I press down?
Nope.
Okay. So I'm just feeling to make sure it's not distended or rigid and it feels good, okay? I don't feel any distension or rigidity.
Okay.
I'm gonna pull your gown back down. Okay. So your tube looks like it's in place, and we've got you on the suction like the doctor ordered. So I'm gonna go ahead and lower your bed back down, okay?
Okay.
Like I said, I know this might not be the most comfortable position, but this is as low as we can go. Are you comfortable for now?
Yes.
Okay, great. And I got your bedside table all nice and cleaned off while you were gone, okay?
Okay.
So this is ready if you need it. And then I'm gonna check and make sure this is locked. Good. And I'm gonna bring your trash can right over here. In case you need to throw anything away, okay?
Okay.
So before I go, I do want to let you know that I want you to look out for things like feeling nauseous, feeling short of breath, if you're feeling feverish or flushed. Those are all things I would need to know about, okay? They're a sign of complications. And then I want you to be very aware of the tube. I don't want you to pull at it because you could pull it out, okay? So please don't play with it, don't touch it, okay?
Okay.
Okay, and then here is your call light. Right here. Do you need anything before I go?
No, I don't think so.
Okay, and then would you like your lights off or on?
You can leave them on.
Okay, and then would you like your door open or closed?
You can leave it open.
Okay, I'm gonna head to the nurse's station and document this. I will be back within an hour to check out your abdomen again, okay?
Okay.
Okay, and then I go to the nurse's station and document.